All right, welcome back to TV5 News at 9. Joining us this morning is Dr. Hisham Gayar from McLaren Proton Therapy Center. Doctor, thank you so much for being here. How are you today?
I am doing great, and thank you for having me.
You are very welcome. It is so good to see you and hear from you. So today we are talking about recurrent cancer. Now, first, when it comes to recurrent cancer, doctor, what is proton therapy and how can it help in that sense?
All right. Well, proton therapy is a unique type of radiation. There is a particle therapy that can uniquely give the dose of radiation at the target, precisely protect normal tissue around the target, and our organs that doesn't need to get radiation are protected. And to answer your first part of the question, recurrent cancer is cancer coming back.
Okay.
And returning cancer or showing up the cancer somewhere else in the body or in the same location, unfortunately, is something that we see commonly. And sometimes means of treatment are exhausted and the patients are told, we can't help you anymore. And proton therapy comes as a great tool to help those patients. Hence, we can spare normal tissue. Then it is safe to retreat or to treat again. And that is the concept we're talking about. So if I can say a couple of words about proton therapy and how it works, it's a particle, it's the nucleus of a hydrogen atom spent or shot at speed into tissue to land precisely where it's calculated, knowing what it's going through, and deliver with the maximum radiation, 70-80% of the dose, in a spot. And we paint in 3-dimensionally the target spot by spot, covering the cancer, sparing normal tissue. There is no exit dose, unlike conventional radiation where it goes through.
Yeah.
Big difference. And it is an expensive treatment, but it is covered by insurance and can help where other cancer treatments stop.
All right, doctor, good to know. I want to circle back, though, to something that you just mentioned, that sometimes when the cancer does come back, patients can't undergo surgery or radiation or chemotherapy treatments again. So you say that they can qualify for proton therapy then?
Well, thank you. Anytime we treat cancer, the first time treatment is the best chance to control that cancer. Because once you do surgery, the scarring after surgery makes additional surgery difficult. Once you do conventional radiation, giving radiation again, the normal tissues around the target have been treated because the radiation goes through. And you cannot give radiation again. And chemotherapy, there are certain tolerance, and sometimes you can change drugs. So there are limitations of how many times you treat. And unfortunately, the hopes of cure drops every time you give a treatment for a second chance, and often we cannot give that additional treatment. With proton therapy, because it's a unique tool, if we use it upfront, you can easily and comfortably treat again.
Yeah.
That's one advantage. Second, if the patients have been treated with conventional radiation before, and the radiation is needed to cure the cancer, we do not stop. Proton could be given because the normal tissues are protected, and the radiation goes only where it belongs, in the cancer or where the cancer is or where the target is. So yes, to answer your question, we can deliver the radiation with proton therapy when patients are told, you can't have any more radiation. Surgery is difficult and we cannot touch again. And for the right indications, it is covered by insurance and approved. And we're having great success treating many patients in different parts of the body for cancers that are recurring. I hope I answered your question.
Absolutely, you did. Thank you, and great to hear from you on that. And now, doctor, I wanted to ask, can people seek out proton therapy as their first treatment? I know you were talking about radiation chemotherapy sometimes being somebody's first treatment. Can they just jump right into proton therapy?
Actually, that is usually better, because then the normal tissues are not insulted and they can not only retreat, there would be no reason to give radiation again, because the cure rates are better, the side effects are less, the treatment is better tolerated, the quality of life after treatment is better.
Okay.
Because that particle therapy is so precise, it stops at the cancer and doesn't go into the tissue surrounding. So it is covered for indication for first-line treatment for many cancers now. And the best is if you have cancer, find out if proton therapy is better for you. Just give us a call, or you can seek at the website, and we can answer and see if you would benefit from it or not before you even travel and come over. We can look into the case by telehealth and evaluate if that the help is needed or not, and we have navigators that can work with the patients through that. And for doctors that are facing difficulties treating their patients somewhere else, have been reaching to us and saying, can you help here? And in many occasions we can, and we can provide support.
Very good. Now, if people at home missed it, how can they find out more information to see if proton therapy is right for them?
Well, simply if there is diagnosis of cancer, find out if proton therapy could be used to help. You can call us by calling 855-MY-PROTON, or you can go on the website and check mclaren.org/proton therapy, and you'll find out and learn more about how to reach us, explain your case. We'll ask for records and information. We may contact your doctors if needed, or just go over the case, get your consent, decide before you even travel if this is good for you or not, and take it from there.
All right, doctor, this has been great information. Thank you so much for calling in this morning.
You're welcome. Thank you for having me in your program.
Yes, of course. Stay safe, okay, my friend?
Thank you.
All right.
You too.
I will.
Bye-bye.
Thank you. Now, those at home can find more information in the hot links section by going to our website, WNEM.com.